pay for her rehabilitation in a nursing facility, which costs $28,000.
The whole thing is so outrageous, and it's not right. It's a huge problem.
Hi, this is Joseph Pate, better known as Medicare Joe, and welcome to our channel. Again, today I'm going to just be talking about a snippet of an interview today on skilled nursing care, rehab, and home health care, and it's an interview that was done by NBC News. I've just become extremely passionate about this topic because nobody in the Medicare space is saying anything about it. And it's probably one of the biggest things that can cost seniors hundreds of thousands of dollars when it comes to their care. So we're going to touch on that. And before I get into that, if you haven't subscribed to our channel, make sure you click that red subscribe button down below. And that will update you and notify you whenever we post any new content to this channel so you can stay in the know. But back to the reason for this video, again, it is a short interview done by a woman named MJ, and she talks about her experience after breaking her leg and some of the costs that were incurred there and more or less what she's doing now. And I just want to touch on this. This video interview was aired in 2014, so 10 years ago to date this video, and it's still relevant to you today. Whether you're on Medicare, an employer plan, retiree plan, it doesn't matter. This is still relevant for you today. And maybe even more so based on the cost. So this is a small scale. We'll talk about it on the other side of this video. I'm going to play that now with you and watch that along with you. And when we'll come on the next side, we'll talk a little bit about what was happening and what's going on with this.
And here's what she didn't understand at first. That label, under observation, technically made her an outpatient. And that means Medicare won't pay for her rehabilitation in a nursing facility, which costs $28,000.
The whole thing is so outrageous, and it's not right. It's a huge problem. There are over 1 million, almost 2 million people every year who are stuck in this observation.
Let's fast forward here. I'm going to show the point where she's talking a little bit about how this has impacted her and now what she's got to do. Well, actually, we'll start it here, which is where the hospital says they won't say anything about it. So
that treated Mary Jane wouldn't talk to us either, but gave us a statement saying it is obligated to follow Medicare rules when assigning patients to their appropriate level of care. MJ finds the whole thing unfair. She and her husband, who's had Parkinson's for 20 years, just moved in with their son in Dallas to save money.
I've worked my whole life, and I'm just appalled.
Now any money they can save will go to her rehab. So far, legislative proposals to fix this problem have gone nowhere. Advocates say Medicare patients who...
So some pretty tough stuff there to kind of unpack, right? So she basically broke her leg, and she ended up having to come out of pocket $28,000 for her rehab costs. This is a small scale, folks. We talk about the skilled nursing care and rehab care and how Medicare with employer coverage or retirement coverage covers the first 100 days. This here, though, on a larger scale, if someone's in there for a longer time, can end up being hundreds of thousands of dollars, $200,000, $300,000. At the end of this video, she talks about how she now needs to move in with her husband who has Parkinson's to their son's home because they can't afford anything, and all of the money she is making is going towards paying these bills. So we do a lot of retirement planning with folks, and that's part of our Retire with Joe company, and we always talk about recovery care and what that can do for you, how that can protect you in cases like this. So this video, again, it's 10 years old, but 10 years later from that video, this is even worse now. And the coverage for the cost, rather, for a nursing care stay for 1 year is $100,000 a year, $60,000 a year for home care assistance, someone to come into the home. And that's why we're always recommending that recovery care product. If you haven't watched that video, I'll link it at the end of this video here, and I'll put it in the comments below so you can check that out. But it's about protecting your assets. At some point, because Medicare and healthcare falls short of assisted living care, rehab care, home care, there's a product that can protect your nest egg. So you don't have to liquidate your assets, your retirement account, your savings, unfortunately, like MJ did here, to cover these costs. So Again, I wanted to share this interview with you today because this is real life stuff that's happening. And the folks that are out there that are like, this isn't going to happen to me, or let me put this off until a later date, 70% of folks will experience an assisted living care event in their lifetime. 70%. The time to talk about these products and get these products in force is when your health allows you to. So if you have any questions, please post them in the comments. I'm going to post our number here, so if you have any questions, you can call in as well. Again, our company is Medicare Joe. We're here to give an unbiased opinion to folks, help them, educate them, and get them on the right path of their healthcare plan. Again, I want to thank you for taking 5 minutes today and watching this. And if you enjoyed it, please hit that like button. That helps our channel get more content out to folks here on YouTube. And again, if you'd like to subscribe, hit that red subscribe button. That'll update you as we post new YouTube videos here to keep you in the know about what's going on in the Medicare world. All right, everybody, take care and have a good day.